Hello everybody, welcome to another presentation of our life-changing work here at London Dental Specialists. If you like our videos, please subscribe to our YouTube channel and follow us at London Dental Specialists on Instagram and Facebook. So let's get into today's presentation. It's about this lovely 33-year-old lady who was referred to us because she was absolutely adamant that no matter what had happened, she really wanted to keep this tooth. So let's look at exactly what was going on. And the problem here is this particular tooth, and you may or may not be able to pick it out, but there's a swelling on the tooth. The gum examination everywhere else, including around the tooth, revealed that all was well, but there was just this swelling around it. So the x-ray that was taken showed that the tip of the root appeared fine, but there was this gray area and this whitish thing which should not be there. So let's delve into that and have a look at exactly what was going on. Obviously, when I took the x-ray, I looked at it and had a conversation with the patient. She did say that she had some treatment with a colleague local to her, and after that treatment, all of a sudden, the swelling came up. I managed to get hold of that colleague who said to me, OP, hands up, I made a mistake. And it's really, really important that I, as a specialist, say to you out there that mistakes do happen. They happen, and it was amazing in this situation that the dentist saw that he had made a mistake, put his hands up and instigated a referral through us to us indirectly. And any dentist that says that they have never made a mistake is either one that doesn't do any clinical dentistry or somebody is lying to you. Fortunately, in my own personal practice and in the practice of my associates, it does not happen very often. But our role as specialists is to correct mistakes when they do happen. But the other thing just to be aware of is that in this particular situation, if we had treated it at the start, then the prognosis would have been excellent. But because of the mistake that had happened, the prognosis is guarded. Ultimately, the anatomy of this tooth was slightly different to normal, and it meant that when the dentist was trying to do the root canal treatment to this particular tooth, he accidentally went in a slightly different direction to normal. And again, it was because of the complication in the anatomy of the tooth. Now, the sole reason why I decided to make a video about this is so that patients out there, that you understand that the next time your dentist gives you the option of going to have a root canal treatment done by either specialist dentist or getting it done by themselves, please think about it and think about it really carefully. At the back of the mouth, I would say with absolute certainty that you should be seeing a specialist dentist all the time. In the front of the mouth, before we came across a couple of these cases, we always said perhaps not. But because we're not going to know, okay, and you are not going to know, the dentist is not going to know whether this particular front tooth, which is usually simple, is going to be slightly complicated, you may want to make the decision that you want to see a specialist so that you can get the best outcome consistently in all your root canal treatments. And I think, I know that makes sense in the vast majority of situations. The other thing that I want to do is acknowledge and recognize my associate, Niha, the root canal specialist. I watched her battle hard. I watched her live up to our practice goals, which is to try and save as many teeth as possible. Normally, these root canal treatments on front teeth take about 75 minutes roughly, but in this particular case, it took her 2.5 hours. all right, and she worked and works really, really hard, and got what I thought was, or what I know is, an excellent result within the current circumstances. So let's have a look at exactly what Neha did. And as a reference, I would like you just to bear in mind these white lines. Look at how thin, or relatively thin, this white line is, and you'll see what I mean in a second. This is where we started, and this is the final result. And the thing that I just want you to compare is how much white there is in the root of this tooth compared to this particular tooth. And you can immediately see that there's a lot more white material inside the root of this tooth compared to the root of that tooth. And that is what makes the prognosis in the long term uncertain. But certainly what Neha has done is really seal the internal aspect of that tooth, and then it is up to human biology to see what happens. We may need to do some further procedures down the line just to really optimize that outcome. But the treatment was completed in 1 day. How much did it cost? £1,000 versus the £3,500 for a dental implant. But as I said, the outlook is uncertain. So the take-home message is, one, when your dentist tells you to go and see or consider seeing a specialist dentist for your root canal treatment, please take that advice, because root canal specialists do nothing else other than root canal treatments. And as you can imagine, because they do nothing else other than root canal treatments, they're absolutely amazing at it. But if you find yourself in a situation where something has gone a bit wrong, then we as specialists are here to try and see if we can use our expertise and our experience to try and save your teeth. I will keep you updated about what actually happens with this tooth down the line. We are planning on taking a CT scan of this tooth in January. It was only completed last week, and I hope to be giving you good news in the new year. So why not ask your dentist to refer you to see us, or just pick up the phone. If you know you need a root canal treatment, pick up the phone, and we are willing and open and able to look after you. Many thanks.